Robots in the operating room, new technology, the first of its kind in North Carolina. It's available right here in our area.
And it is being used to treat spine disorders. Carolina in the mornings, Caitlin Stansel at New Hanover Regional Medical Center right now with more details on this big medical advancement. Caitlin, good morning.
Good morning, Bob and Kim. We are live here in the operating room of New Hanover Regional Medical Center, talking about some really exciting new technology that surgeons are using here to treat patients who have spinal disorders. Now, what it is Mazor Robotics. They're able to customize these procedures down to the very most precise, accurate way possible before they even come here into the operating room. If we can take a look at some video from this technology, really the next closest place you can go to get this technology is South Carolina or Virginia. Only 70 of these robots available in the United States right now. And what it does is it allows surgeons to really plan out this spinal surgery before they even come into the operating room. They say it helps them to really make sure that the surgery is precise and accurate as possible, getting down to really a detailed blueprint before they even come in here, and to use that to perform the surgery in open and minimally invasive surgery, both of those options available. Now, we talked to one patient who says she had been dealing with back pain for more than a year, but after having this surgery, only 4 small incisions on her back, she was able to get up the very next day and walk. She said she was really excited about having to find some pain relief just going through this surgery.
We were walking, we were getting done, and it made it better, yeah. But I think it's because I didn't have such a serious outside incision and everything else to worry about also, because I probably wouldn't have been as anxious to do things with worrying about that.
Now, coming up here in the next half hour, we're going to be talking to some of these surgeons about just how exciting this technology is. The first time being used here in North Carolina, right here in the Wilmington area. So really exciting times for New Hanover Regional Medical Center. We're going to have more coming up here in the next half hour in Carolina in the morning, so make sure you stay with us. Back to you guys in the studio.
For our state right now, some new technology is being used to treat spinal disorders in operating rooms and being done right here in Wilmington.
It's giving pain relief to patients who have struggled for years. Carolina in the morning's Caitlin Stansel live right now from New Hanover Regional Medical Center this morning, talking with some doctors about this procedure and how it might help you. Caitlin.
Good morning, Kim and Bob. We're live here in the operating room at New Hanover Regional Medical Center, talking about some really exciting new technology that is offering patients relief from back pain. If they have spinal disorders, what they have here now is a robotic system to kind of blueprint, map out the surgery, and then place screws in their back. And really, it's all about precision and accuracy. I have Dr. Matt Hubbardy here with me.
Hi, I'll correct that. I'm not a doctor. I am the administrator for neurosciences here. Yes, we acquired this technology about 8 months ago. We are the first one in the state of North Carolina to offer procedures with the Mazor robot. And it really benefits our patients by making smaller incisions, helping to reduce postoperative pain, blood loss, and ultimately shorten the length of stay for the patient. So anytime we can do anything minimally invasive for the patient, it's a better service for them.
This is the first time this kind of technology is being used in North Carolina. Why is that so exciting?
I think that shows the commitment New Hanover Regional Medical Center has for our patients. We have other technologies similar to it, along the lines of really shortening the length of stay, improving the overall patient experience here. That has gone a long way in helping us grow volume, and we use these as marketing tools as well. So it's just a great benefit for our patients to have this as an option if they do fit the criteria for it.
And you've done about 30 of these surgeries.
We have. We've done about 30 of them. I think we shared a patient story this morning, and we've had wonderful outcomes with it so far, so we're very happy that we were the first in North Carolina to adopt this technology.
What's kind of been the response so far from these patients?
The patient feedback has been quite positive. When you're suffering from some of these terrible deformities, scoliosis, you have pain constantly. Our patients are seeing pain relief post-op day 1. They're getting up and walking and really getting back to resuming their normal daily activities.
And I think one question that a lot of people are probably wondering about is what kind of patient would come in for this kind of surgery?
Usually that's going to be driven by the doctor. Not all patients will fit the criteria for this approach. I would definitely leave that up to the surgeon to decide that if you meet that criteria, if this is a good match for you, they will make that decision. But for any patient who's having bad deformity, bad scoliosis, this might be something that's good for them.
Really exciting new technology here at New Hanover Regional Medical Center. We have some of those details on our website right now, wect.com, so go there for a look at some more information on this. But for now, back to you guys in the studio.
The doctors here in Wilmington are some of the very first helping patients with having back pain problems. Caitlin Stansel joining us right now. She's over at New Hanover Regional Medical Center with a look at the new treatment, hopefully to help a lot of patients.
Good morning, Bob and Kim. This is a really exciting new technology being used for the first time in North Carolina and available right here in Wilmington at New Hanover Regional Medical Center. Mazor Robotics system, what they are using this for is to treat spinal disorders, help people with back pain. And I have Dr. George Huffman here with me to kind of explain a little bit about how you use this robotic system and what kind of patient would be ideal for this surgery.
What this is, it's a robot that allows us to very precisely place hardware in people's spines, specifically screws that go in the bones in the back, in the low back, and in the mid back. It allows us to use far less radiation for getting those screws in than we would conventionally, and it allows us to put them in exactly where we want them. It's very important because before we come into the operating room, we actually plan out the trajectory of the screws. So we sort of go through the process on the computer in our minds, and we're able to see where everything's going to go.
So when you come in here to the operating room, you already kind of have a blueprint laid out of exactly what you're going to do, where these screws need to go. But what kind of patient is ideal for this kind of surgery?
Well, anyone who needs a lumbar fusion, so someone whose back is unstable for some reason, or someone who's had a fracture or that type of thing, is ideal for this type of procedure. It also allows us to do some things minimally invasively and put the screws in through tiny little holes. It's just very exciting for the patients here in southeastern North Carolina.
And what do you think is maybe the most exciting part of using this robotic technology right here in the operating room?
I think the most exciting part for me is bring the latest and greatest technology to our patients, and it's the ability to do the things that we have been doing for years and years with much more precise and much less radiation. I think is just awesome.
What is the recovery time like for these patients?
It depends. Most people in the hospital anywhere from 1 to 3 days, and then it takes them about 2 to 3 months to get back into their more normal activities.
Wow, this is really exciting news, not just for right here in New Hanover County, but also across the entire state of North Carolina. Just under 70 other places in the United States using this technology, and the closest really South Carolina and Virginia. This is the kind of stuff that you would see at maybe a Duke University, right?
Well, nope, they don't have one yet.
They don't, but I mean, if you're thinking about this kind of technology, most people's minds go to those kind of facilities.
Yes, usually the bigger universities, but that's why we're very grateful that New Hanover has helped us to get this.
That is so awesome. Well, we have all those details on our website, wect.com. You can go there for more information about this really exciting new technology. But for now, back to you guys in the studio.
Surgeons using a robot to reconstruct parts of the back and help patients find relief. Caitlin Stansel live right now at New Hanover Regional Medical Center with a look at the new treatments and who it can help. Caitlin.
Good morning, Kim and Bob. We've been live here in the operating room at New Hanover Regional Medical Center all morning talking about really exciting new technology being used right here. What they're doing is it's called Mazor Robotics. It helps patients with spinal disorders get some relief from back pain. What surgeons are able to do is go in and really make a blueprint of the patient's spine before they even go in and put in the hardware to help them find relief. Now, officials here say that this is a really exciting new technology. It's only being used in less than 70 places here in the United States. The closest places, South Carolina and Virginia, but for now, the first time in North Carolina is right here at New Hanover Regional Medical Center, and surgeons here are very excited to be using this, and patients as well. We talked to one patient who says She had been having back pain for more than a year, and the very next day after having this surgery with the Mazor Robotics system, she said she immediately felt relief.
You hear all this in the big hospitals, and because I'm from the Washington area, so there's a lot of things that are going on up there, but it's, when you really think about it, it's really amazing that they can go in, and it's so precision, and you don't have to make great big holes in the body and disturb a lot of things to get things fixed. So I think it's great. I think it's amazing.
Now, surgeons that we've talked to this morning say that this system has really helped them to become more precise and more accurate when they are putting in this hardware. And we're going to be talking to more of them on our sister station, Fox Wilmington. But for now, you can go to our website, WECT.com, for all the details and information you need to know about this exciting new technology here at New Hanover Regional Medical Center. But for now, back to you guys in the studio.
More details on this medical advancement and whether it might help you. Caitlin.
Kim and Bob, really this technology is focusing on patients with spinal disorders, feeling back pain and looking for relief. They're using Mazor Robotics, a really exciting piece of new technology that is helping surgeons kind of map out the plan even before you get here into the operating room. I have Dr. Adam Brown here with me to kind of explain a little bit how you do plan in advance before you start the surgery.
Good morning. So this is basically a tremendous new resource we have that creates a GPS of your spine. And the reason it's better than the previous technologies is that it registers each individual vertebra of the spine independently, whereas older technologies did one reference frame, and the farther you got away from that, the less accurate it was. So this is tremendous new technology, and basically here's how it's done. The robot will give us this GPS, and then before the surgery we can plan each individual screw at each vertebra, both in an axial plane, or a plane that cuts through the body this way, and also in a side view or a lateral plane. And it's extremely precise, less than 1 millimeter.
Wow, and we actually have some video of this surgery in progress, as well as some other video scenes there. But can you kind of talk about the recovery time for these patients and how long this surgery process is?
Well, it all depends on the actual operation and what that patient needs. If the patient needs, say, just 2 vertebrae to be fused, where we place 4 screws, the operation might take 30 minutes. If it's a condition of scoliosis where they might need 10 or 12 screws, obviously that's going to take longer. It may take a couple of hours. But the recovery time is still quite a bit less than it was with the open techniques or even the older techniques with this GPS type technology.
And you kind of just touched on this a little bit, but what kind of patient would really fit this type of surgery?
Any patient that needs a fusion or screws placed into the spine is a candidate for this. Most of that is degenerative disease of the spine. There are probably in the range of 3 to 5 million adult Americans who have this condition. And that number is continuing to rise as we live longer and want to be more active. But also fractures from car accidents or falls, infections, all of those people are candidates for this operation.
Wow. Now this technology, really the closest states that are using it right now are South Carolina and Virginia. And for the first time in North Carolina, New Hanover Regional Medical Center, the first one in our state to use this Mazor Robotics system. Really exciting technology. We have all those details on our website, foxwilmington.com. You can go there now for that information, but also stay with us here on air. We're going to have more coming up in the next half hour. For now, back to you guys in the studio.
A first for our state, new technology now being used to treat spinal disorders in operating rooms right here in Wilmington. It's giving pain relief to patients who have struggled for years. Carolina in the Morning's Caitlin Stansel live from New Hanover Regional Medical Center this morning, the home of this piece of equipment, the only one like it in the state. Good morning, Caitlin.
Good morning, Bob. That's right. This is the first time it's being used in North Carolina right here at New Hanover Regional Medical Center. And this technology, Mazor Robotics, just this little piece of equipment right here, about the size of a Red Bull can. That's all these doctors need to use to help patients with spinal disorders, having back pain, help them find relief. I have Dr. Todd Rose here with me to talk about a little bit about, why is it so important that it's not this robot that's in total control. You still have a lot of control when you're in here in the operating room.
Correct. This is an exciting tool to use because it can help you plan the surgery preoperatively about exactly where you're going to place the screws on a CT scan preoperatively. And then it can help you to place a guide wire, and then you'll put the guide wire down the pedicle, which is the placement for the screws, and allows for much more accurate.
Why is it so important that here at New Hanover Regional and in the Wilmington area that this kind of technology is available for you to use?
Well, it's important because we can use it in either open or minimally invasive surgeries to, again, provide more accurate placement of the hardware, overall a safer surgery, and can address more difficult cases where the deformity before may make it more difficult for us to get the screws in exactly the right place. The preoperative CT scan combined with the intraoperative registering of the patient to the machine helps with the placement.
What has the response been from your patients so far?
Very good, very good. They're excited about it.
And can you kind of talk a little bit about the recovery time?
Well, recovery time depends a lot on the size of the incision, and this robot does enable us to plan for smaller incision type surgeries. So doing minimally invasive surgery, which can be done either with or without the robot, is a little bit more helpful with the robot.
And this technology only being used, the closest states in South Carolina and Virginia, less than 70 being used worldwide. So it is a really awesome opportunity that you have this here at New Hanover Regional Medical Center.
It is. We're very excited about it.
What's probably the most exciting part of using this?
The preoperative planning helps a lot in terms of severe deformities where there's rotation. That can be very difficult using just plain fluoroscopy. The other exciting part is that we can use less fluoroscopy, so there's less radiation exposure both to the patient as well as to the staff in the room during the case.
Now, we have all these details on our website, foxwilmington.com. You can go there for all of this information, but for now I'm going to send it back to you guys in the studio.